Welcome everyone to this episode of Freedom Hub's presentation of the free market cash patient. I'm your host, Jeff Cantor, along with Charles Frohman. We're definitely sponsored by the Marketplace for Health, Wealth, and Freedom, and we want to invite you to check that out. It is definitely the disruptor's intersection for sure. This are being recorded, so we'll talk about that in a minute, but just to kind of reiterate, there's a bit of a problem in the medical world, and most everybody's starting to finally figure out what the challenge is. It's just you and your doc, and then whatever has to be dealt with is really where we need to be. And there's any number of things that could be painted on the back of this person blocking access. And then, of course, who's in charge of information? So, what are you going to believe? Where do you know? What can you rely on? How do you get to the truth? And as I said, we do have another show, so we want you to take a look at that. That deals a lot more freedom issues and the like. And then, as I said, this is the main website. There's two ways to get there. Both of these domain names take you to the same place. Let's take a quick peek for a minute before we dig into today. So when you get to the site, you'll notice there's a lot of drop downs and continually added information. Under the home tab, there's webinars and continuing the conversation. We're going to start there because that's the most important part in many ways, because after we have the session today, you're probably going to go, wow, that was interesting. I'd like to follow up on that. Well, that's where you're going to come to find out what's next. So here's your way, a chance to connect with any of the guests that have been here in the past. Been a lot of really great ones. You'll certainly want to take a look, see. And then when you kind of move along here, you'll see under freedom, we've got fighting for freedom, another critical element. These are some action issues that are kind of hindering us as individuals. And these are some in ever growing list of organizations working for us. There's select videos and things to check out. We actually have the Marketplace where we curate some pretty unique stuff, not a lot of things, just some key things. Some important stuff has popped up that's been in here for a little bit, but suddenly it's meaning something a little bit more. And then we have the webinar page. So under home, there's webinars, and that's where we are right now. So let's start drilling into today. So we list the 4 o'clock and the 7 o'clock and what they're about. And then there's a little breakout as what's coming up, so you can plan ahead. And then down here, importantly, is where you're going to come back to, because this webinar is going to be posted over the weekend to all 4 of these particular links. So as an example, if we run over to this one over here at Brighteon, it'll be the one in the first, let me close a couple of these pop-ups. It'll be this first video here, and you'll be able to kind of have the chance to review a bunch of the past ones, as I said. And then if you're inclined on any of them in particular, then you can continue the conversation. So, but let's go into today. Let me back up here a minute. I'm going to have Charles jump in here and give us a little intro on our guest.
Gladly, Jeff, and welcome, Matt. Matt, to Jeff and me, is the son of an important person in our life. Not that Matt isn't important, but Matt's dad, Tony Dale, Dr. Tony Dale, is a pioneer in the cash patient-making business for which John Goodman at Forbes featured Empowering Benefits that has partnered with Sedera for years to make cash patients. And with the libertarian background that Jeff and I have in politics, cash patients shopping on price and quality is a thing that does not happen enough to really fix the supply and demand of healthcare. Healthcare is a top-down behemoth, and there are a few players that have tried to disgorge prices from this opaque market. Trump's disclosure rule was helpful, although in the news, the hospitals and insurers are doing their best to avoid disclosing useful bundled prices, but you got to have those prices to shop surgeries, tests, and any kind of health service, really. The most successful price disclosures are the advisors for the big groups, the big companies that are booting out the insurers and replacing them with direct contracting with hospitals and independent ambulatory centers that will offer bundled upfront pricing. Obamacare has helped the pricing revolution because insurers have had to boost deductibles to be able to afford to offer guaranteed issue to all the sick people out there. And when you have a $5,000, $10,000 deductible, you are, my friend, a cash paying patient, because you pretty much will never use your insurance. Everything is cash in that deductible. We don't see cash paying, though, as a bad thing. It's a great thing. And doctors who have an independent bent crave them. So many doctors have settled for employment in hospitals, and they find themselves no more happy there than they were dealing with all the red tape as an independent doctor. So with the app that Jeff and I are involved with around cash transactions, we really are trying to work with employers and clusters of providers to really get the cash transactions going. And at Sedera, our sharing partner for years, Dr. Dale's Karis Group, and now his son's version of the company, the Health Point, or is it Point Health? Sorry, Matt, have been the ones that have been negotiating the hospital bills, drilling them down to a more competitive rate. And so Matt is the expert to tell us the state of cash shopping. Is it really having an impact on the market? Is it the future? So that's our intro, Jeff.
All right, very good. Well, let's get rolling here. So, Matt, I'm going to flick the screen over to you.
All right. Well, Jeff and Charles, thank you so much for the introduction. Let me get my screen share started. Are you guys able to see the screen?
Yes, very good.
Awesome. Well, I thought maybe it would be interesting before I jump into some of the information on cash pay patients and how it affects providers. I thought it might be interesting to share a little bit of my story, which I mentioned, it really begins with my dad. So my dad started a company called the Karis Group in 1996. He was a physician by training. We grew up in England, and he had a medical practice in London, which he moved on from when I was, 10 years old. This was in the 80s. And he moved us over here to the States. And if you fast forward 10 years to 1996, he's playing basketball and he ends up blowing out his knee. And he knows right away that he's going to need to have surgery. And so he reaches out to an orthopedic surgeon and asks what the cost of the surgery is. And he's told that the price would be $2,500. And he says, yeah, that sounds reasonable. Let me go ahead and get the procedure done. And he goes into the hospital and has it done. And it's, he's in and out in a few hours. And then all of the bills start coming in. And he does get a bill for $2,500, but that's just the surgeon's portion. And then he gets a bill from an anesthesiologist, and then he gets a bill from the hospital. And all total, the total cost came to around $18,000. And I think he was really surprised by, the American medical system and how much the charges were. And so he decided that he was going to challenge those charges. And so he reached out to each of the providers that had been involved. And I think as surprised as he was by how much they had tried to bill for, a relatively minor outpatient procedure, was how quickly they agreed with him that he had been overcharged, and he was able to get the amount reduced down to, I think, around $3,000, which was a lot closer to what he expected to pay at the beginning. At the time, my dad was a member of a healthcare sharing organization called Christian Care MediShare, and all of Christian Care's members are technically cash pay patients. And so while they have a sharing community behind them, they do, essentially pay cash. And he asked Christian Care, would you like us to do type of work for your other members? And they said, absolutely. And so out of that injury, playing basketball, the Karis Group is born. And if you fast forward to the year 2000, this is a piece of the story for any of you that have met my dad or talked to him that he doesn't often talk a lot about. But he had signed an exclusivity agreement with MediShare, and MediShare ended up pulling the contract away from him, really because of how much they owed him due to how much he was saving them. And so he went from having a small but highly profitable business one day to having a business that essentially had no revenue the next day. And he had a staff of, I think, around 10 folks. So, obviously felt responsible for their families. And because he had had an exclusivity agreement with Metashare, he hadn't been permitted to go out and get other clients. And so he was really in a bind. And it was right at the time as I was, finishing up school. I was at Texas State studying criminal justice. And I get a call from my dad, and he basically says, "Hey, Matt, here's what's going on. I've had to, mortgage the house. There's all of these things that have happened. Would you be willing to come and help out in the family business?" And I said, absolutely, I'd be willing to come and help out. And then he said, there's kind of a catch, which is that I'm not going to be able to pay you because the business isn't in a position to have any money to do that. And so I spent the first year of my working career out of college, working for the Karis Group at no pay. But I agreed to, exchange my time with my dad for shares in his company. And so at the end of the first year, not only had we been able to get the Karis Group to the place where it was profitable again, but I was now also the second largest shareholder in the business. I ended up staying with the Karis Group for 10 years. And the Karis Group really has two services that it offers. It offers a navigation product where we help members that are looking to get medical care and they're not sure where to go. And then we have a negotiation product where someone that has already incurred a medical bill will go in and negotiate the prices. And so for 10 years, I ran the service team at the Karis Group that was in charge of doing all of that work. Around 2010, I started feeling like I was getting burned out. I had gone back to school and was now trying to get a second degree in business administration. And it was working crazy hours. And I remember my dad came into my office, and I think he had been out of the country or something. And I hadn't seen him in a few months. And he walks in and he asked me like a really simple question. It was basically like, "Hey, Matt, how are you doing today?" And I was so tired and so stressed. I almost had a nervous breakdown and just, I started crying in front of my dad. And I told my dad, I said, "Dad, I've got to slow down. I've got to take a break." And so, we worked out what it would look like for me to stay on as a consultant for a few months. But then I ultimately left the Karis Group in 2010. And I spent the next 4 years really working in sort of the tech startup world here in Austin. And I had two different companies that I started that were acquired. And when the second one was acquired in 2014, I decided I wanted to take some time off. And so I spent the next 3 years hanging out with my daughter, making YouTube videos. And it was a lot of fun. I really wasn't doing a lot with my life. And I stayed on the board of the Karis Group. And my dad had asked me at various times, would I be willing to come back and, help him do stuff at Karis or help him start a TPA? But I always told him no. I felt like I had given him, a decade of my life already, and I wasn't sure that I wanted to give him another 10. Then in 2017, I got a phone call from a friend of mine. It was a girl named Rachel that I hadn't seen. I hadn't seen her in probably 15 years. She was a really good friend of mine from high school. I don't even think I had spoken to her for probably 5 or 10 years. And she reaches out to me out of the blue. And she essentially said to me, "Matt, I'm dying and I need help." And I said, "Well, Rachel, tell me what's going on." And Rachel shared with me the story of what had happened to her in her life over, sort of the last 5 or 10 years. And she had developed some really serious medical issues, some really serious substance abuse issues. And she was at a place where she hadn't eaten solid food in 3 months. She was down to 90 pounds. And, she knew that she was really at the end of the road. If she wasn't able to get help now, she knew that she wouldn't live a lot longer. And so I told her, I said, "Rachel, I said, absolutely, I want to see what I can do to help. Let me get back to you." And after getting off the phone with her, I was immediately transported back to the 10 years that I'd spent at Karis. And I did for Rachel what I'd done on literally thousands of cases before, which is I started doing some research, and I, made a list of all of the different treatment centers that were in Texas that might be able to really, I think, deal with Rachel's underlying substance abuse issues. And I reached out to all of them, and I found a facility called the Arbor. And, I explained to them what was going on with Rachel, the health conditions, the fact that she had actually been to 28-day treatment programs, 3 different times, each time had relapsed. And I asked them, I said, what does someone in Rachel's situation, what do they really need? And the guy said, it sounds like if she's dropped out of 28-day treatment 3 times, what she really needs to do, she's going to have to do a week-long medical detox. Then she needs to do 3 months of inpatient treatment, followed by a year of outpatient treatment. And that's just to deal with the substance abuse stuff. Any medical stuff outside of that is a separate issue. And I said, well, what's treating the substance abuse? What's that going to run? And he said, for the first 3 months, it's going to be $90,000. And, so I did with that potential bill, what I've done with lots of bills for other folks, is I worked my way up the chain of command. And I ended up talking to the director of the facility, explained the situation, and very graciously, they were willing to reduce the charges from $90,000 down to right around $30,000, which was an amount I was able to help Rachel come up with. But going through that process, I certainly learned a lesson from that. And I think what I realized was that while I might have been really enjoying my time off, I definitely wasn't using the gifts that I had been given, and certainly hadn't been sort of realizing the maximum potential of my life. And so I reached out to my dad and said, Dad, what does it look like, for me to come back? And are there things you need help with? And he said, absolutely. And so I came back and started back at the Karis Group in 2017. I was head of strategy for Karis from 2017 to 2020. And then in 2020, I left to start Point Health, which was really a technology company that would be doing the same things that the Karis Group did. And then partly succession planning, partly my dad's desire to spend more time with his other company, Sedera, he agreed to sell the Karis Group to Point Health. And so now I run those companies as a combined entity. There's a lot of my journey, and I maybe just want to share really briefly, why we do what we do before I get into sort of, the results of it. But when I think about, what it is that we want to do with our time, I think we've got a promise that we make. And the point how that promise is one that we make to our clients and to their patients, that we want to make healthcare easy to find, easy to understand, and easy to afford. When I think about what our vision is, this is what I want us to work on over the next, sort of 3 to 5 years, which is, I want people to look back and say we played a key role in fixing the broken healthcare system in the United States and the world. And our purpose, this is why, this is what motivates me to wake up every day and go to work, is to make quality healthcare a human right. That doesn't necessarily mean it's a human right that I think the government should afford. But I do think everybody should have access to healthcare at a price that's affordable to pay. So a little bit about, our company. We've got 25 plus clients. We've got over 700,000 members that have access to our services. And through our navigation and negotiation product, we average right around 44% off when members have medical bills and they come our way. And, sort of since inception, we've saved, close to $400 million for folks. So, jumping into, one of the big problems, and it was either Jeff or Charles that, sort of touched on this, but I, maybe articulate it in a slightly different way. What, we see the problem as is that, healthcare in this country has a uniquely dysfunctional system of free markets. in that you have medical providers that are for the most part for profit, but coming out of a lot of stuff that happened towards the end of World War II, the primary payer for healthcare in this country isn't actually the patient, it's an employer. And employers, well, they want to see savings on healthcare. They don't really understand why. And because you have health insurance companies, and I love the that was put up at the beginning that shows insurance companies in the middle as part of the problem. They absolutely can be part of the problem, and through unintended consequences of bad legislation that mandates how much an insurance company that they have to pay out. I think it's 80% of their the revenue that they bring in from premiums towards claims. There's been this cap on their ability to make money. And so they only actually make more money as the volume in dollars of claims go up. And what that's led to is just a really crazy system where providers to go up so they can make more money. Insurance companies actually want the price to go up so they can make more money. And patients, the ones who are actually shopping for care, aren't necessarily incentivized because they're not the ones that always pay for it. One of the other questions that we sort of asked ourselves is that, if I guess if there's one thing that, folks are really good at doing, it's shopping. If you ask somebody, where you go to shop for, meal delivery, they'll tell you, well, I go to Grubhub or I go to Uber Eats. If you ask them where can you go to buy household goods, they'll say, Amazon or Walmart. But if you ask someone where do they go to shop for healthcare, they have a really hard time answering that question. And it's especially surprising when you realize that, there's 100 million Americans that are paying more than 50% of their healthcare costs out of pocket, and that there's 81 million Americans that are on high deductible plans. And so, this has caused lots of problems in the insurance world. You see ever, escalating healthcare costs. You see ever escalating insurance deductibles. And you also see an industry that in general, as an ecosystem, has a relatively low net promoter score. A score of 14 is, for an industry, is nothing to brag about. It's probably, about the same place that Congress ranks. And so, the question is how can people get engaged to reduce their own medical costs? And, the title of this presentation was, it's not where it's not who it's where you go. And that's really where you are going to see the most significant savings. And so I want to give a real world example of a case that came through our office here within the last 30 days or so. We had a person that reached out to us that needed to have a rotator cuff surgery. And he was part of an insurance plan that we would describe as a limited benefit medical plan. And so the way that his plan worked is no matter where he went, his insurance company was going to pay $3,000 towards the cost of the procedure. Now, the local hospital where he initially wanted to go told him that a rotator cuff surgery was going to cost $68,000. His insurance company would have paid $3,000, and he would have been responsible for $65,000. Well, obviously, first of all, $68,000 is an insane amount of money to spend on a rotator cuff surgery. And when we reached out to the hospital, they very quickly admitted that, yes, it was an insane amount, and they gave a 50% discount for patients who were self-paid. So if he had gone in and instead of saying, hey, I have insurance, here's my plan, it just said, I don't have insurance at all, he would have been quoted, a cost that was 50% less than what it was going in with insurance. But even more importantly than that, if he had known where to go, there was a surgery center within a 30-minute drive of his house where he could get everything done. The cost of the facility, the surgeon, the anesthesia, everything all in with a bundled price that was under $10,000. And, the challenge that I think we're trying to face as we introduce transparency into the medical ecosystem is, how do we get this information in front of patients? We know we can do it. We know that there's significant cost savings when patients interact with a company like Point Health, even if they're part of a health plan. We instantly see a large boost in the Net Promoter Score. We see significant savings and significant reductions. So not only is it good for patients to know where to go, it's also good for providers, and it's good for the industry. And there's a couple of reasons for that. I think at the end of the day, and I recognize there's probably a mixture of medical professionals and healthcare finance people that listen to this podcast. In the medical world, there is a pretty clear dividing line between the clinical side of medicine and the financial side of medicine. And people that go into the financial side of healthcare, they go into it often for the exact same reasons that people become doctors and nurses. They go into it because they want to help people. But so often they're onboarded into a broken system where if you work in the financial side of healthcare, if you work at a large insurance company, your job might be, sending out explanations of benefits that are impossible for patients to understand. If you work in the financial office of a hospital, your job might be deciding which bills get written off to charity care and which ones get sent to bad debt for collections. And, what the challenge is that there's all of these people that go into the financial side of health with their heart in the right place, but end up serving sort of a deeply flawed industry. And we absolutely think that, if there's a way for medical providers to really embrace, encourage, and accept not just cash pay patients, but the whole concept of ethical pricing, charging one price for everyone, regardless of who's paying it, how much the patient's paying out of pocket and how much the insurance company is. If we're able to get the industry to make that shift, we're going to unlock so much human potential that is currently, part of the inertia in an inefficient and often immoral system. So I really appreciate folks letting me walk through that brief presentation. And I think a lot of the information that will follow, would just love to have a Q&A and answer any questions folks have about cash pay patients and how they can save money. I'm happy to take the conversation anywhere folks would like.
Perfect. That was great, Matt. Appreciate that. It's interesting what's been afoot and what you guys have been doing for such a long time. It's really matured into a, kind of a science in some ways. What is it doing to nudge, influence, or impact the BUCAs of the Blue Crosses of the world? Or do they just act like you don't exist?
So, I think, big ships move slowly, right? So, Cigna and Aetna are both clients of ours, and we're embedded in certain parts of their plans. And the reality, though, is what's going to cause, I think, a big shift in the insurance company. We're starting to see it happen now, which is that the C-suite in businesses is starting to get involved in the no longer just delegating it to HR. If you're a CFO and your healthcare expense for your employees, in most companies, it's the third biggest line item on their P&L, and they're starting to demand some accountability. Just like they wouldn't allow one of their employees to consistently stay at a hotel that was $10,000 a night when they were traveling for business. They're starting to get involved in what type of safeguards are built into plans to really control cost, and whether that's something that maybe has mixed results like reference-based pricing or defined benefit plan. The people that ultimately are affected in their pocketbooks are paying attention to this issue because of how out of control it's gotten, and those people will drive change inside of the BUCAs because that's where the BUCAs make their money.
Very good. Well, that's nice to hear. Charles, I see your hand up.
Thanks, Jeff, and thanks, Matt. Great presentation. What do you think about Trump's requirement to disclose prices for hospitals and insurers in a bundled fashion to facilitate the shopping? I've heard there's been some resistance from the institutions, or they're not disclosing the right prices or everything needed for the bundle. Have you gotten involved with that issue at all?
We're certainly, very familiar with it. I'm not sure we are involved, but let me just maybe share some thoughts around it. So, what's happening is that clearly, especially on the hospital side, hospitals benefit from a lack of price transparency. And so they've either, for the most part, not every hospital, but for the most part, taken one of two approaches. They've either put the information out there that they need to comply with the legislation around price transparency, but they put it out there in a format that's almost impossible to find and almost impossible to interpret, except for the most sophisticated of people that work in the financial side of healthcare. Either that, or they've ignored it completely and said, we'll pay the fines because the fines are small, rather than having to comply. And so where we're involved is one of the things that we've spent a lot of resources on over the last year, getting ready for the price transparency laws as they were going to take effect, is really understanding how we can take individual CPT codes, create the bundles, and from data that's available from CMS, we can make a pretty educated guess, maybe not to the dollar, for a hospital that isn't complying with the price transparency rules, but certainly reflective of this would be the cheapest hospital, this would be the most expensive, even if they haven't complied. And so I think what we've done is we've said we're not going to wait for the hospitals to get behind the movement to transparency and fair pricing. We're going to create a solution that allows us to present this information to patients in spite of the cooperation from the hospitals.
That's excellent, because that's pretty much what it's going to take. You just got to force the situation a little bit, because the consumer's certainly not going to have any qualms about what you're trying to do, nor those employers. Charles, did you have your hand again there? I think I saw.
Yeah, and also in my intro, I mentioned the impact of the bigger group advisors in disclosing prices, as they require bundled advanced pricing from their direct contract partners. Is that something you've seen also with those Rosetta type brokers and more innovative employers? And if so, is it having any impact, or is that market so niche that it's going to take a while to really proliferate?
Well, I think it's going to proliferate. The question is, and that no one knows the answer to, is, how long and how much, right? And so, as I sort of look into the crystal ball, and say, well, what's the timeline? What's the horizon for this to happen? I think for price transparency to go from a, very small percentage of providers to, call it 80%, I think it's going to happen, but I think it's 5 to 10 years. And when I say transparent, but I mean that they're participating willingly in the process. That no one would go to a restaurant and when they ask to see a menu, be told no, and no, we're not going to tell you what it's going to cost. But that's what happens with medical providers. But once you start moving towards price transparency, I don't think the movement can be stopped. It's going to take time, but because it exerts, downward pressure on prices, there'll be a lot of people that fight it. But, if you have it, because so many people have a high deductible plan and want a place to shop, if given access to that information, they're going to go to the low price providers that are part of the price transparency movement. And that's going to incentivize the providers that are high priced and are not part of the movement to participate because they're losing business. So ultimately, this thing is going to gather momentum.
That's good. That's exactly the typical domino approach. So there you go. Sam, I see your hand up. You have to unmute yourself there, potentially. Can you do it there? You have to look around the edge. There's a little unmute icon.
There you go. Can you hear me now?
Yes.
Okay, hi, thanks. Yes, I was on mute. I didn't realize. So I agree, price transparency is a critical aspect of bringing prices down. But as you mentioned, Matt, it's also a pretty foggy area. And how do you really um, uh, get to real price transparency the way you can get for airlines or flights, for example, on kayak versus the MSRP that dealers publish for cars, right? I mean, they're two totally different ways of looking at pricing. But the question I had for you, what exactly is your platform doing? Are you providing actual rate cards for different services? Or are you providing, basically saying this is a lower price provider compared to another provider? Or are you providing bundle pricing for high value procedures? What exactly is your company doing for facilitating price transparency? And the second part of the question, I'm sorry, I'm going to throw that in here as well. Have you looked at this company called Transcarent that just came out of Silicon Valley and what they're doing, and how does that sort of maybe how are you different, or how does that compare with what you're doing?
Sure. So let me answer the second part of the question first, which is I'm not familiar with that company, so don't know how we compare, but we're certainly not the only people that operate in this space. There's lots of companies that work inside of cost containment and are looking at providing tools that allow consumers to help shop for medical care. Going back to the first part of the question, I like to think of it in terms of there's layers of data, right? And so there's data that we have, some of it proprietary to us, some of it, is not proprietary to us, that allows you to get the exact price for a medical procedure. And there you're in there, what I would call their, 5% of providers and procedures where you're swimming in crystal clear water. We can say with a really high degree of confidence to our patient, this is exactly what you're going to pay for this procedure if you go to this provider. But I recognize that only 5% of the water is crystal clear. As you start looking at the rest of it, it starts to get muddier, right? And the muddier the water gets, the more that you're giving a person directional information, or information that's directionally correct rather than statistically accurate to the penny. And so we've done our best to say to patients, here's what we think you're going to pay. We think this is as accurate as possible. And when we feel it's highly accurate, we'll tell them it's highly accurate. We'll tell them you're going to pay $8,970 for this procedure at this provider. When we're making an educated guess, we'll tell them it's a guess. And there are parts of the country where the data is either not available, or we have such a, what I would describe as like, our confidence interval in the data is not high enough that we're even willing to present a price. What we would say to a patient, in general, if you need this done, we can tell you in the aggregate, this is the lower cost provider in your area, but we're hesitant to give them a price. Certainly not using our technology solution. We can always do it through the call center, because we run a call center as well. We can pick up the phone and get quotes, but it sort of leads to a bigger issue that we're working on trying to solve along with others, which is, in order to make an informed shopping decision, there's 3 pieces of information you need when it comes to medical care. You need to know what it's going to cost you. That's the first, and I think arguably the most important piece, although you can really put these in any order. The second thing is you need to know what the outcome is going to be, or certainly what the likelihood of a positive medical outcome is. And the third piece is you need to understand what the patient experience is going to look like. And if you're able to provide insight into all 3 of those pieces of data, you're giving a person the information they need. But as with any, problems that are hard to tackle, I think you have to be okay with something less than perfection, because anyone that was striving or said they, had perfection when it came to medical pricing for every provider, certainly at this point in time, I don't know anyone that's close. I think we're working on it. I think lots of smart folks on it, because it's not only is it a tough problem to solve, it's an important problem to solve. And you've got lots of smart people. And yeah, I'm not surprised to hear of a company coming out of Silicon Valley, one that I haven't heard of, because there's lots of smart people looking at this problem, trying to figure out how to solve it.
Yeah, great answer. Thank you very much. If you don't mind, I'll just follow up with that with a comment, which is, I think there's two ways people are trying to solve the problem. One is to provide guidance the way you're doing. The other is to provide actual contracted pricing. And I think the latter part has its own challenges, right? But what's your experience when you're talking? You work with thousands of providers by the looks of it. What's your experience in terms of being able to get actual contracted prices, or sort of a rate card type of model of pricing? Is that feasible down the road? Because that's what some companies are trying to do. Is that something that you think is ever going to happen, just given the forces of the insurance companies and all on trying to keep prices masked?
Yeah, I mean, I certainly think it's feasible, right? If you want access to claims data, especially if it's been anonymized so that it's not, you don't have any HIPAA issues, there's lots of clearinghouses that'll give you that data. Now, whether they should be selling it to you or not, pretty much all data is available for a price. And so conceptually, while it's hidden from the public, it's not necessarily hidden from people inside of the industry.
Right.
As far as what different insurance companies are paying and what those rates are. And so for an average patient that's interested in knowing, well, how much am I getting quoted as a self-pay patient versus how much would Humana pay for this, or Blue Cross, or fill in the blank with any other insurance company, that information is going to be pretty hard for them to get. But the information is certainly available on an enterprise level for companies like ourselves to slice up and interpret, to try to help patients understand that question. But it's not being voluntarily handed over by the hospitals.
Got it. Thank you.
Apex, I see your hand up.
Thanks, Charles. And then I have a couple of questions. And one of the things that you stated just a little while ago is that there's really three things that members and individuals and healthcare people going into healthcare are looking for. And it's built around cost, the outcome, and the patient experience. And what we've been finding is whether we're working with a third-party administrator that's really focused on not only delivering a reference-based pricing model, because reference-based pricing model is just going to be a structured fee schedule predicated on Medicare. But the providers that we're seeing that are having administrators that are having a lot of success in this world are really driving members to providers that have the highest outcomes. With those providers that have the highest outcomes normally comes pretty good patient experiences and also reduced cost. So the three are tied together, but really which ones comes first? And but I think going to having your care done by providers that have great outcomes, I think should be a very strong focus on a lot of that. Secondarily, there is as a member, I've been privileged to work with Sedera, as a partner with our suite of neck plans that we pair with Sedera Health. But there is so much power in actually going before you have care rendered, letting them know that I think they look at you sometimes like you're cross-eyed, and I don't have insurance, I'm a cash pay patient. And I recently had care rendered at a facility that was actually owned by Blue Cross Blue Shield. So you wouldn't think that there's going to be a whole lot there to work with. So the surgical procedure that I had, the hospital portion of the bill Just the hospital portion for about a 7-hour procedure between walking in there, getting anesthesia, recovering, and walking out is about 7 hours. The hospital portion of that bill was $24,000. Because I advised them out of the gate that I was a cash pay patient, I got a bill for $4,000, 80% discount, just by saying I was a cash pay patient. And the surgeon's fees were discounted immediately 50%. The only greedy in the guys in the bunch, which are going to be almost in all cases, is the anesthesia. So the anesthesiologist, gave you 0 discount. And but it was all in all, it was just a very, very positive experience. That is I'm out talking to other brokers and out making presentations with those brokers to their clients. When you can relate that personal story, and the value and the power of a cash paid patient is a huge story to tell when you have that own personal experience.
Yeah, I mean, I 100% agree with everything you just said. And, especially, the second part, absolutely true, right? I mean, there's nothing more powerful than a personal story. And, just seeing the discount that just from asking the question, I'm cash pay, what's available for me? How much can be saved? But the part where you talked about the correlation between cost of care, quality of care, you're 100. All of the data that we've looked at shows that there's actually an inverse relationship between cost and quality. In the absence of pricing information, so many people do what I call a vanity buy, right? They go to the most prestigious facility. Here in Austin, there's a really, I don't want to call it snobby, but there's a part of town that's really wealthy and it's got its own hospital. It's a part of town in Austin called Westlake. And people would assume that, the medical providers in Westlake are the best. The reality is that's often not the case. If you want to get the best quality care in Austin, go to Texas Free Market Surgery Center. And not only are you going to get the best quality care because they're working with the best surgeons in each of their specialties, you're also going to get it at the lowest price. And so, yeah, it's so true. Just want to highlight that you're absolutely 100% right on that point. It's so counterintuitive to how people are used to shopping. It's almost ingrained in people's heads that, like, hey, the car is better if it costs $100,000 versus
Exactly.
if it costs $15,000. And with cars, it's true, but with healthcare, it's not. Certainly not always.
Thank you, Matt.
Yeah, thank you.
Very good, Charles. I see your hand up.
Thanks. I'd asked Jeff if Dr. Wallen can unmute himself. He's going to present in a couple of weeks on his independent urology center that he's building around cash only. How that relates to the conversation, since he's part of the growing list of specialists who are trying to kick the reimbursement addiction and really help with this bright future around cash. While he unmutes himself, if he chooses to, I'll ask Matt, what about Obamacare making a population of cash patients from the huge deductibles they've imposed on families? You picture, for a story, you're a realtor, too successful for a subsidy. They're paying a mortgage for healthcare, which includes $5,000 to $10,000 deductible. So they're never going to use their insurance. It's all going to be cash, right? How has that growing population of cash patients affected your business?
Yeah, so I mean, I think for us, because we, being fully transparent here, our clients span the continuum of the healthcare spectrum, from the boogers down to the small limited benefit plans and everything in between. So for us personally, whether we agree with the legislation or not, obviously we don't want to see people struggling to pay medical bills wherever they are on that continuum. We might see growth in certain segments of the industry, and stagnation in other parts. And so, I mean, as an example, one of the areas that really grew because of the passage of the ACA was healthcare sharing organizations, because they received an exemption from having to comply with the individual mandate of the ACA. And so we saw that section of the industry over a period of a decade grow from, call it 300 to 400,000 members in total in the entire country to, 3 to 4 million people. And so, yeah, I mean, the legislation affects us because it moves the blend, but it's sort of moving stuff from client A to client B.
All right, Dr. Walland, I see you're unmuted.
Yeah, I mean, thanks for bringing me into the conversation, Charles. I mean, I think it's just like y'all have been talking about, trying to have the highest quality, lowest cost care in the country. I mean, certainly, the problem with even for myself, as a solo practitioner, trying to get insurance companies to pay me for the value that I provide is significantly difficult, right? And so they just basically look at me like a little fly and swap me around. And actually, from that standpoint, being able to directly, I think it was mentioned earlier, being able to directly contract with patients, actually, from a physician standpoint, is fantastic, because we save them money, provide them still the same highest value, and yet it makes our lives a hell of a lot easier, and most likely, probably, potentially even more profitable than through the silliness of the insurance corporations.
Yeah, I mean, 100% agreed, right? It's and you're obviously seeing, part of or a section of the price transparency movement is obviously a move towards, whether it's direct primary care or inside of some of the specialty, different business models, right? It doesn't have to be the status quo, which is, as a physician or a surgery center or a hospital, that you're paid by the insurance companies. You can have a direct relationship with the person that needs medical care, and it's normally a win-win situation for everybody, including as a physician, your quality of life, right? It's you don't want to spend your time dealing with insurance companies over payments any more than patients want to spend their time dealing with insurance companies trying to figure out why some portion of their bill didn't get paid.
Right. And not even that, just not even having to worry about, getting a bill 6 months later, right? Where they didn't even expect was coming, thought they paid everything already. And, again, going back to that transparency conversation where, rather than being aloof and pretending like you can't provide an actual price for somebody, being able to come out the gate and say, listen, this is the cost that it will be, and we can figure out a way that you can work on that or whatever. But, you don't have to expect that 6 months down the road, you're going to get some random bill from whomever that you're going to be accountable for.
Yeah, 100% agreed. And I think surprise billing is the prevalence of it is what's put so much pressure politically to come up with a solution. Is at the end of the day, politicians react to what they think will get them elected, and the challenge is that you've got two different camps, right? And this might not be a popular sentiment to state, but I think it's worth stating, is that possible solutions exist on both sides of the aisle. And so, with a one payer system, they would put price controls in place. It would solve some of the problems. The side effects are not worth the cure, though, which is a complete lack of innovation. I don't want the government in charge of my healthcare any more than I want them taking over Gmail. But I understand the appeal and why people vote for politicians and say that, hey, let's just give free healthcare to everybody. The flip side is that, you've got to have pre-market principles that apply and are applied in the same way they're applied in other industries. Because with the unusual hybrid system we have, and the quirky economics of the healthcare system, we've created the perfect storm, and there's plenty of blame to go around, spread among, administrations going back to the, 80 to 100 years.
All right, Paul, I see your hand up.
Yeah, nice presentation. Yeah, I just wanted to ask, one of the areas that I'm in is care coordination, specifically with case management, utilizing nurses. So the nurse is basically the go-between between the doctor and the, whoever's administering the claim. But in this case, working with the free market healthcare system, instead of in a typical carrier type of adjuster, you would have something different. And I'm just wondering if there's still a place in free market healthcare for that type of care coordination.
Well, certainly, for someone who's managing a long-term chronic condition that spans multiple providers, I think it's really helpful. But as more patients have a direct relationship with their provider, and providers are able to spend more time with them, I do think, the reality is that the need for that level of assistance from a third party probably does go down some. But it's not an issue I've thought a lot about. So that's sort of my initial reaction to your question, but it's not something I've put a lot of thought cycles into.
Yeah, primarily that type of care coordination would be for complex and catastrophic type of cases where sometimes there's a breakdown of communication. But yeah, certainly I think with free market healthcare, it's probably tighter coordination than it would be with the carrier system.
Yeah.
But yeah, at any rate, I just wanted to ask that.
Well, yeah, and I certainly think there'll continue to be a need. One of the things that's happening though, right, is as medical providers move away from the current system, they're doing smart things in addition to transparent pricing. And so one of the things that we're seeing an increasing amount of is just communication among providers, where they're really looking at it as being part of a care team. And so, I think we're seeing enough people in the industry that are fed up with how many things are broken that they're looking at lots of solutions to fix it. But I don't see the need for care coordinators going away, but I would guess that there's a higher they probably provide a higher value the more confusing the system is inherently.
Okay, thank you.
All right, very good. Well, Matt, lo and behold, we've reached the conclusion of the day. So I wanted to definitely tell you thanks for today. That was really quite good and enlightening, and of course encouraging, because as you can see, it's moving in the right direction. We just need to keep banging at it and pick up speed. So thanks for being here today.
Well, guys, thank you so much. Really appreciate being invited, and thank you. It was a pleasure. Thank you.
Thank you.